Good afternoon. Good afternoon, everybody. Good to see you. Another beautiful day, and it looks like it's going to be a beautiful weekend. So finally, we have some great weather breaking our way, and I hope everybody has a chance to enjoy it over the weekend. I want to thank you for tuning in at 1 o'clock. I'll be back here Tuesday at 1 o'clock. We're taking the weekend off, and also Monday on account of Memorial Day. I will be having a Memorial Day ceremony, which will be broadcast live on Monday at the Veterans Cemetery in Exeter. And I would ask everyone in Rhode Island to take a moment on Monday to do something in honor of our veterans, and particularly those whose lives have been lost defending this country. I want to continue to keep tuning in to these press conferences. There's going to be a lot of information coming out in the next couple of weeks as we begin reopening our economy, beginning childcare, beginning summer camp. It's very exciting, I think, that we're at a place where we can do this, but I want to keep you informed. I want to keep you calm and well-informed and confident as we move forth to this next phase. Today, I'd like to begin, as we always do, with the data, and I'd like to ask that we put up on the screen the data. As you can see, we're continuing to head in the right direction. This picture is a good news picture for Rhode Island. Today, we have another 170 cases to report. Not good news is that we have 23 additional deaths, and I would ask Rhode Island to realize every one of these is significant, and we have to remember this virus is taking a very real toll on so many Rhode Islanders. I want to begin today. The primary focus of my comments today is going to be around phase 2. But before I address that, I do need to take a moment to say thank you. We have, as a community, been at this now for almost 3 months. And I don't know about you, but for me, it feels like a lot longer. They have been a long and difficult, uncertain, anxiety-filled 3 months. But now we are through the worst of it. We have done, as a state, an excellent job of keeping ourselves safe, coming together as a community, and getting us to this place. And I just want to say thank you from me to everyone in Rhode Island. To those of you who haven't had a day off since this has begun, and there are thousands of you, I want to say thank you. Some folks have been working harder than they ever have. And by the way, some of them in really difficult, scary circumstances, at hospitals, at nursing homes, in home care, in doctor's offices. Thank you. To all the business owners who've done the right thing by obeying the rules, even though it has come at extreme financial cost for you, I want to say thank you. To the everyday Rhode Islanders who are just following the rules, wearing your masks, washing your hands, taking the day off if you're sick, helping your kids out when they're struggling. Thank you. To the teachers and students and parents who've done distance learning, I want to say thank you. And hang in there, please. It's hard enough as it is to keep kids focused when spring comes. It's triply hard this year. It's just a couple of weeks left. These kids deserve the best chance they can to learn. So please, everybody, hang in there, give it a final push to get over the finish line for an excellent end of school. To everyone who's been kind, how many times have I been at this podium asking you to be kind to a neighbor? Every time you've risen to the challenge, checking in on a neighbor, delivering groceries, just offering a kind word, being patient. That has what has gotten us to this place. So I could easily stand here for an hour and give all of the thank yous. I won't do that to you because you're busy, but it's very important for all of us to recognize the sacrifices that have gone into getting us to this place today. And I just want to say thank you and just say not every state is doing as well as we are. And that's because of you, because you decided to do the right thing at every turn. So I appreciate it. By the way, that spirit of kindness the desire to follow the rules, the desire to learn how to live with the virus instead of denying it or fighting it, that's what's going to keep us safe and active for the next year until we find a vaccine or a cure. I wish this thing would go away. I really do. That can't happen, which means let's just live with it. Let's crush COVID together. Let's get back to work, back to the beach, back to life, back to dining, back to getting our hair cut with the new rules. Don't fight them, follow them. Don't fight the rules, follow the rules. It'll keep you safe and get you back to work and allow Rhode Island continue to be a shining star for America on how we're getting through this together. Another big thank you. 30,000 of you have downloaded the Crush COVID app. That's pretty incredible. We launched it 2 days ago. In one day, we went from 0 to 10,000, then to 25,000, and now 30,000. By the time I'm back here on Tuesday, let's get ourselves to 45,000. Please, just try it. If you try it after a week or two and you don't like it, disable it. But give it a try. It could mean the difference between life and death for a lot of people. And I'm asking you to take 10 seconds, download it, and give it a try. Also, we're continuing to make it better. You know, this is version 1. Some of you are saying you like it, but it drains your battery. You like it, but it's difficult to use. Okay, well, we're working on fixing it. But just try it and let us know how to make it better. Okay, so I want to dedicate the next few minutes to talking about where we are and where I'd like to see us go. So for the past few weeks, we've been in the testing the waters of phase 1, putting a toe in the water and seeing, are we ready? And the answer is we are. You guys are doing a great job. You're wearing your masks, washing your hands, following the rules. Not everyone. So if you're not, I'd ask you to try harder. A week ago, I said if we saw less than 70% of hospital beds filled, consistently 30 or fewer new hospitalizations a day, a rate of spread, what sometimes people call the RT or the R naught, of 1.1 or less, and that we were on a trend such that we wouldn't double our hospitalizations in less than a month, then we could move to phase 2. So based on everything I know today, we are on track. And that's good, that's great. So if those trends continue, it is my intention to move to phase 2 on June 1st. Now, it's possible that next week we start to see cases climb, hospitalizations climb, the R naught climb, but I'm trying to there's going to be a lot of preparation between now and June 1st to get yourselves ready and your businesses ready. So I want you to know my intention, assuming we continue to stay on this path of stability and plateau, is to embark on phase 2 on June 1st. So as many of you know, there's currently an executive order in place detailing the rules around phase 1. That order is set to expire tomorrow. So I've extended that order until June 1st. Now, I want to be crystal clear. That means the phase 1 rules apply until June 1st. I'm taking a risk here by announcing phase 2 guidelines. And the risk is you're going to go out and start living this weekend according to phase 2. If you do that, that'll be a problem and it'll delay phase 2, or it'll get us into trouble a couple weeks from now. So I want to remind you, for this weekend and until June 1st, social gathering limits are at 5. The travel restrictions apply. If you go to another state, you come back, you're in quarantine, unless you're going for essential reasons and work. And just let's stay hunkered down for another week. Having said that, I want to give you a sense of what life in phase 2 is going to look like so that you can start to get prepared. I will say now, it's going to be a big phase. There's going to be a lot of changes, and it's a big reopening relative to what we've done, which means the thought in your head should be, oh man, I better follow the rules so we can get through it safely. My focus is going to be on work, getting people back to work. That is what we need to do safely and responsibly. Most sectors of our economy are going to see some form of reopening. Pretty much every sector is going to see a form of reopening. And we're finally going to get to start doing the things that we've all missed. All state parks and beaches will be open with capacity limitations and social distancing restrictions. Childcare is going to resume on June 1st with new restrictions. Houses of worship, churches, synagogues, mosques, all houses of worship will be allowed to open with new restrictions up to 25% capacity starting May 30th, the weekend, next weekend. There's a lot of other changes, so bear with me. When we enter phase 2, the social gathering limit will be lifted to 15. This weekend, it's 5. But when we start, hopefully, on June 1st, it's going to go to 15. That is a big change. So basically, I trust you. I'm leading with trust and confidence. Don't hang out with 15 different people every day. That defeats the purpose. Be vigilant about your contact tracing notebook. If you have a gathering, you invite your family over, you have a backyard cookout, you're hanging out in the park with 15 people, great. Jot down a note. Wash your hands and wear a mask. Try to keep your groups consistent. It's just, the whole way this virus spreads, it's like a pebble in the lake. If you're with a different 15 people every day, it can get out of control pretty quickly. Having said that, we miss our friends. Our kids miss their friends. We miss our families. Some of us can't even have a family gathering if you can only be with 5 people. So it's time. It's time to be with friends and family and loved ones and colleagues safely in groups of 15 or less. Travel's a big deal. We're approaching the summer. We have to get our tourism industry back on its feet to the extent possible. So in phase 2, travel restrictions will be largely lifted with a few key distinctions. The 14-day quarantine will only be in place for those folks who come back to Rhode Island or come to Rhode Island from a place that still has a stay-at-home order in place. So essentially, if you're living in a place that has an outbreak or has a shelter-in-place order or a stay-at-home order in place, then if you come to Rhode Island or return to Rhode Island in phase 2, you'll still have to quarantine for 14 days. But at this point, there are very few places that still have that, which means travel will become much freer in phase 2. Still no international travel. Restaurants and retail. The folks that have been hardest hit are service industries. If you have friends and loved ones in the services industries, they are getting crushed all over the country. And so I've tried as hard as possible to keep restaurants going, however limited, with takeout, beer, wine, cocktails, curbside pickup, delivery. Many of you have gotten so creative, but most of you, it's just not worth it to be open for that limited business. So now we're doing outdoor dining, and I hope some of you are taking advantage of that, but even that isn't enough for a lot of restaurants to reopen. So in phase 2, beginning on June 1st, we're gonna allow the outdoor dining, but also indoor dining at up to 50% capacity. If we have a picture of what that would look like, if you could please put that up on the screen. Just I want people to get a feel for what they're gonna look like, how's it gonna feel, what's gonna look normal. So there's a picture on your screen now. Going out to eat is gonna feel different, no doubt about it. People are gonna be wearing their masks, you're gonna have to keep a distance. There cannot be a line at the hostess station to wait for your table. There can't be a line at the bathroom. Restaurant owners are going to have to do a lot more cleaning. There may not be menus because we can't have shared menus that go from table to table. But we're going to get out there again. At 50% capacity, we think a lot of restaurants can get back into business and start to break even, thank God. I want to give a massive shout out to the Rhode Island Hospitality Association, Dale Venturini and her colleagues. You know, it would have been easy for restaurant owners to be just angry and frustrated, and very justifiably. You know, I would be angry and frustrated. But instead of doing that, they've helped us come up with solutions. They've been very reasonable, productive, and constructive. And I want to thank you for that. And because of that, I think that the guidelines, which we're going to put out next week, are going to be excellent and hopefully helpful. All of these guidelines are meant to help you and to not, you know, be overly burdensome. They're meant to give you a hand in figuring out how do we reopen. In any event, for those of us who are in a position to go out to a restaurant, I'd ask you to do it. You know, help the community if you can. If you're a little nervous, maybe wait a week, but go ahead and get back out there. And to the restaurants, 50%, I hope, is a good beginning. I want to talk for a second about offices. Most office-based businesses have by and large been able to be very productive by just having their folks work from home. And they've done a beautiful job adapting to the circumstances, video conferencing, teleconferencing, just learning how to be productive working from home. We did a survey of Rhode Island's, you know, biggest office-based businesses, and by and large, they report high productivity from people working from home. And many of them say they're going to continue to let people work from home for a long period of time. Having said that, there are some jobs which you just have to be in the office to do. And so out of recognition for that, in phase 2, we're going to allow office-based businesses to bring back up to a third of their workforce. We came up, there's no magic number, 25%, 50%, a third. This was a number we settled on after many, many discussions with businesses, and we settled on a third. Some people wanted less because they're nervous. Some people wanted more. Here's what I would say. In phase 2, if you can work from home, work from home. If you're a business, encourage your employees to work from home to work from home. If you're an office worker and primarily your job is on the phone or on the computer, work at home. Having said that, it's also time to have some confidence to be able to go back into the office, work in a team, and do the necessary work that requires collaboration in the office. There's going to be a lot of restrictions, more cleaning, less congregating, new rules around an office cafeteria, mask wearing, and your businesses are going to provide that, and they're going to keep you safe. To employees who are nervous, I just can tell you this. We've been in great contact with companies. They're going to do the right thing. They're all bending over backwards to learn how to do the cleaning, to make sure you can stay home if you're sick, how to either take your temperature or do other screening to make sure no one in the office is sick ever. So it'll take some time, I expect, to ramp up to 30%, a third. But over time, you know, that's not going to happen on day 1 of phase 2. But over the course of phase 2, I think we can move to that a third occupancy. And businesses will have to be vigilant, and I believe that they will be vigilant. Okay, a big category, hairdressers. At least 5 times a day I get asked, when can I get my hair done? Good news, you can get it done starting June 1st. In phase 2, beginning from phase 2, we're going to be bringing back online most personal services. So hair services, including barbershops, salons, hair braiders, will all open but with capacity restrictions and new cleaning regimens and mask wearing requirements. So this will be nail care, waxing, tanning, massage, tattoos, all going to be allowed to reopen with new rules and new restrictions when we commence phase 2. And here again, we have a picture. I'd ask if you please put that picture up. It's going to be different. It is going to be different. It is going to be awkward. You're going to have to make an appointment. You're going to have to wear a mask. You cannot go if you are sick. You will have to cancel your appointment if you are sick on the day of your appointment. We can only enable services where masks can be worn primarily throughout the duration of the service. So cleaning is going to be incredibly important. We have a whole new cleaning regime for hairdressers, barbers, and the like. Customers are going to have to spread out. So again, there's a picture there. We have to just become comfortable with these new norms. But the good news is we can do it. We can get our hair cut. We can get a massage. We can do what we need to do, we want to do, and we're accustomed to do. And the really good news is barbers can get back to work and open their shops and start living again and operating their business. Earlier this week, I just need to pause here to thank Commerce Secretary Stephan Pryor. He has had, it is not an exaggeration to say, probably 1,000 phone calls with businesses at this point, and I mean individual phone calls, to try to come up with the right set of rules and guidelines in order to enable phase 2. Just the other day, he had a Facebook town hall just for hair professionals. We received 6,000 comments and more than 30,000 people watched. So to give you a flavor for this, we are not embarking on this in a willy-nilly relaxed fashion, because I want you to feel confident when you go to your hairdresser or your barber, it's okay, it's safe. We have labored over this. We are allowing it because we think it's safe, and we have really good buy-in from hairdressers, restaurant owners, gym owners, retail operations, that they are going to follow the rules. And we're going to be doing a lot more spot checking and enforcement. So it is time to get back to work, but I want you to have a sense of confidence that we're doing this in a way that you can leave your house and do your business, see your friends, get your hair cut, go shopping, and be safe, even though the virus is still living with us. By the way, I want to thank all of those businesses who have been engaging with our team. You've been fantastic. The best thing you've done is to tell us what you can do. There's no point in us putting out a regulation that you can't follow. And so we've tried to put out regulations that we know you'll be able to follow. Also, I want to say this. These are not intended to be permanent and forever. This is going to be difficult, cost you money, hamper your business. The second that we are able to release these additional burdens, we will. I don't want you to think this is a forever kind of a thing for your businesses. I am having run a small business myself, I am highly conscious of the difficulties and burdens that this is going to put on you. And so it's for a limited period of time, and it's necessary. And by the way, it'll give your customers confidence. Gyms, I get asked a lot about gyms. We all want to stay healthy and active. We want to get fit and stay fit. So good news, for those of you who want to go take a yoga class, go to the gym, take the kickboxing class, you're going to be able to do that again in phase 2. In phase 2, gyms and fitness studios will be allowed to reopen, again with restrictions. Group fitness classes are also going to be allowed to resume. And please put up the slide for what a picture of a gym might look like. It's going to be different though. Limited groups of classes, outdoors encouraged whenever possible, social distancing, mask wearing where appropriate. Try to stick with the same class. If you take your favorite class, try to stick with that group throughout. rather than a different group for your fitness class every day. The name of the game through this whole phase is going to be maintaining your social distance and keeping your group size small and consistent. By the way, that's not just true for gyms, that's true for everything. So gyms, fitness centers, we're going to ask them to go with a reservation system so they can prevent overcrowding, and just different regulations around social distancing and a lot around cleaning. Again, we want you to have confidence. Next week, Commerce will be hosting a Facebook Live to answer questions just for gyms and fitness centers. And I will have updates soon around exactly when that's going to be. Okay, outdoor entertainment and recreation. So as I have said from the beginning, some of the last things to come back online are going to be events that rely upon big groups, concerts, big festivals, places where in order to do your business, you have to congregate in big groups. That, unfortunately, isn't going to be back for a while, mostly because it's virtually impossible to maintain social distance in those environments. However, in phase 2, we're going to start allowing outdoor activities to come back. So that would be things like the zoo. We've been in great discussions with the zoo, and thank you for your collaboration. That will be able to come back online for the outdoor activities in phase 2. Other outdoor activities like mini golf and boat rentals and lots of outdoor activities, visits to public gardens, outdoor grounds of historical sites. We know the science is such that you're much safer outside than inside, and frankly, it's easier to keep people spaced out outside. So we'll be talking more about that next week as well, but I wanted to give you a preview. So let me pause for a second. There will undoubtedly be 100 questions. What about this? What about that? So let me just say this. Next week, sometime after Tuesday, there are going to be very detailed industry by industry guidelines posted on the reopeningri.com website. I would ask you to wait until then for your very specific questions. Have a look next week online, reopeningri.com. Check it out next week, and you can go there and see in great detail how, the regulations and expectations by setting. Because these are big changes, I wanted to take a minute today to just lay out what you can expect. This is going to be different. It's going to be new. It's going to take a while to get used to it. And so I thought people are wondering what comes next. When does it come? What's it going to look like? And I hope by now you have a sense of what's it going to look like. In the meanwhile, this weekend, cannot say it enough times because I'm going to get asked. If you travel to see somebody for Memorial Day and you come back, yes, you should quarantine for 14 days. Can you have a party in your backyard of more than 5 people over Memorial Day? No, you shouldn't. Can you go to the park and have a big football, some kind of game that you want to play? No. 5 people. Get through the weekend so we can get to June 1st so we can get back to work. I want to say one last thing. We have been in consultation with people from every walk of life, mayors, faith leaders, small businesses, large businesses, labor, union folks. I mean, we're really, really committed to getting input. We're doing it every way we can. Emails, Facebook Lives, town halls, one-on-one conversations, daily calls with municipal leaders. Like we're really trying to get the feedback. And by the way, adjusting. I know there's a lot of people who are nervous about this, and I do want to acknowledge that. If you talk to the mayor of Central Falls or Woonsocket or Pawtucket or Providence, they're a little nervous, and I understand that. They're nervous because their communities are still struggling. still have a lot of folks living in high dense situations, that our testing shows that people are still reluctant to get tests, and the percent positive is still high. I'm hearing from business owners, big and small, Gov, I'm just not ready. I'm just not ready to bring back a third of my employees. Many faith-based leaders have said, it's great that we can bring back up to 25%. I'm not going to do it. And my answer to that is, that's fine. I think it's safe for you too, as long as you follow the rules and enforce the rules. But I also think you know what's best for your community, for your congregation, for your business, for the people that you lead. And so if you feel the need, because of the circumstances of your community, to take it slower, then by all means do that. And call us. Let us help you work through it and move at the pace that you think is appropriate for the circumstances in your community. And not every community is the same. If you have a community, whether that be business or social or whatever, where everyone's going to follow the rules, then you can have more confidence. If you know the people in your community aren't going to follow the rules, then I would go slower too. If you think that the people in your community are going to bunch up together, not wear their masks, come even if they're sick, violate the rules, then you probably should go a lot slower. But if you think you have a community where the prevalence of the virus is lower, people are going to follow the rules, then I'd encourage you to get going, because we do have a lot of folks out of work and we want to get people back to work. And again, I can't say it enough, but people say to me all the time, do I feel safe? Yes. I'm going out to dinner tonight. I can't wait to get my hair done. I'm going to go to church next Sunday. So, I wear my mask. The kids wear their masks. Like, I'm living it with you. And I think it's time, and I think it's safe. So if you have any questions or comments, you can go to the Reopening RI website. You can find us. We're pretty easy to find. And let's just follow the rules so that when June 1st comes, we can proceed in the ways I just laid out. Sorry, that was long. It was a lot of information. I'm going to turn it over to Nicole and come back for questions.
Thank you, Governor. Good afternoon, everyone. Happy Friday. I want to start off with echoing a few of the items that the governor shared about phase 2 that you just heard. I want to really reiterate thanks and appreciation to Secretary Pryor and the Commerce team. I have firsthand experience in seeing his ultimate commitment to making sure that there is full engagement across the state of Rhode Island with the various sectors that have been involved. And we can certainly say that from a public health perspective, knowing that guidance is underlying every step that is being made. The public health includes making sure the economy's health is good, making sure that our education and childcare readiness is good, and making sure that all elements of communities are coming together in a way that keeps the public healthy. So we have done that together, and people can be reassured in that confidence and safety as they are returning. I also want to reiterate what the governor said about us needing to be focused on our communities that are being hardest hit as things open up. We have that as the utmost priority as we're going forward, continuing to make sure that the testing, contact tracing, quarantine and isolation supports that need to be in place, and we've been working hard to have in place for the communities hardest hit, continue to be bolstered. We are going to continue to monitor the data very closely at a very granular level. We're going to continue to work with local leadership in the cities, particularly those that are most disproportionately impacted. And we're going to continue to work with the existing infrastructures in these communities. They know what they need. We want to support them in going slow and taking the time they need to make sure that we begin to address together the higher percent positivity. We have the health equity zones infrastructure as one. We have the Equity Council. We have a large group of stakeholders that will be critical as we make sure we continue to listen to the residents in these areas. We need to hear their experiences and continue to be responsive to that. I often say that your health should not depend on your zip code. The challenge before us right now is to reverse that trend, use this COVID-19 pandemic to address that and make it so that every zip code has what they need in this response and in going forward with quality education, housing, and commerce. Also, to shift gears to talk about data before I update, I want to note that while we will be posting data updates online on Saturday and Sunday, we will not post an update online on Memorial Day. The leadership team of the statewide COVID-19 response and at the Rhode Island Department of Health, including the state health laboratories, will be monitoring the numbers that are needed on Monday. However, we wanted to give some of the frontline members of our data team and our laboratory team and our case investigation team a day to be with their families, particularly to be able to reflect on this Memorial Day. After doing daily data updates continually since early March. Many of these folks have been working 7 days a week. A lot of them have been working 14 and 15-hour days. And so we've all agreed together that this is certainly a day off that is well deserved. In terms of our data for today, we have 170 new COVID-19 cases to report. There are 242 patients who are currently hospitalized. Of those people, 56 are currently in the intensive care unit, and 40 of those 56 are currently on a ventilator in the ICU. Very sadly, we have 23 additional COVID-19 associated fatalities to report. These people range in age from their 60s to being older than 100 years old. 3 people were in their 60s, 4 in their 70s, 9 people were in their 80s, 6 people were in their 90s, and 1 person was older than 100 years old. Our deepest sympathies are with the families and loved ones of these Rhode Islanders who have passed away. Lastly, before opening things up for questions, I want to again reiterate the importance of the basic steps needed to prevent the spread of viruses. Phase 2 that we talked about will not happen until June 1st. From now until then, and continuing afterwards, we all still need to be thoughtful, understand why we are doing this, and make sure we follow the rules about keeping our groups consistent and small. That's the most effective way to continue to stop spread of the virus to additional people. All of these steps help build the confidence for all of us to be able to return to the economy. We need to wear our masks when we're out in public. We need to continue to wash our hands thoroughly and frequently and make sure our kids do the same. We absolutely need to stay home if we're sick and be aware of the high-touch objects and high-touch surfaces around us and do regular cleaning on what we can. For so many of us, this has been a tumultuous, challenging time, but we have been able to follow the rules and get through this together. That is going to continue. Even when we go to group size of 15, still being able to stay 6 feet apart and wear masks everywhere we can will be key to helping us move forward. During periods like this, it's sometimes helpful to focus on what we can control. The steps I mentioned are what each one of us can do to help keep ourselves healthy, to help keep our loved ones healthy, and to help keep our community healthy as Rhode Islanders. We want to stay in front of this together. So with that, let's get started.
Most of the numbers, the trends are looking positive, as the governor mentioned, on cases and hospitalizations, but I am struck there's still a lot of deaths. 58 people have died this week who contracted COVID-19, according to your website. Do you see deaths as a lagging indicator? Are you finding most of those who die, linger for a long time, unfortunately, and therefore they're kind of an older case? Or is it all over the place about the death? It seems like we have a very sad story still in the deaths, even as there's improvement on the general population.
Yes, deaths are a lagging indicator by its nature, but it's not so much because it lingers from cases. It does vary by case, particularly with older populations and those with underlying illnesses. The deaths can sometimes be associated more deliberately, depending on how much higher the risk can be.
Governor, one of the areas that we get a lot of questions about trying to start up again, apart from the things you mentioned today, part of phase 2, is youth sports. And I know you had something to say about that last week. We're hearing from a lot of organizers who are kind of stung by that, I think, and look at Massachusetts talking about youth sports in their phase 2. I know Florida is allowing it as of today. A lot of organizers are telling us they can figure ways to keep the kids apart, and adult leagues too. Have you had any more thought about allowing youth sports in any way? And what do you say to these people who say we can figure out a way to do it, especially like baseball?
Yeah, it's a good question. So as I think I mentioned the other day, we are trying to get a little more guidance from the CDC on this and continuing to work on it. So at the moment, I don't have anything more to say. Certainly, we are encouraging sports and sports camps this summer. But, and so yes, we're working through it, and we might have a little more to say next week.
Governor, it is estimated that tens of thousands of Rhode Islanders have been or will be unable to make rent between April and July, and that this could destabilize the housing market as well as being a humanitarian crisis. 17 states have an executive order eviction moratorium, and the question is, why doesn't Rhode Island have that, considering that on June 2nd, evictions will resume?
Yeah, thank you for asking that question. So we are going to replenish I had announced 2 weeks ago or some time ago, a fund to help folks pay for rent. That is been depleted, and we are going to replenish that. Additionally, I'm in discussion with the courts around how we can work with them to provide a combination of financial support out of our stimulus funds and also a mediated solution, because I want to do better than just allowing people to get through June. I want to have them to have a longer term solution. So I expect to be back out, Tuesday, Wednesday with more details around that.
CARES Act dollars will be going towards replenishing that fund?
Millions of dollars, but I'll come back to you Tuesday.
Governor, what roles have the Equity Task Force and the Lieutenant Governor, with all his conversations that he's had with different silos here in the state from a business perspective, had in your decision to move forward with phase 2 in the ways that you have?
Well, the Equity Task Force has been incredibly helpful. Secretary Jones is leading that effort, and they're in constant contact. In fact, I talked to Wamazetta yesterday. They're helping in so many ways, like how do we get testing into high density, high poverty areas? How do we help the undocumented community to feel unafraid about getting a test? How do we get the low wage healthcare worker to feel comfortable going to live at a brown dorm or someplace else so they can be safe? So what I'm trying to do, I'm trying to lead this whole response with an eye toward equity in everything that we do, not just jobs, not just housing, not just provision of food, not just testing, but there's a person from the equity lens in every call to raise their hand and say, have you thought about this? How does this affect the low-income community? How does this affect the immigrant community? How does this affect the African-American community? just advertising. You know, we got to reach every community with the information. So that's the approach that we're taking. I would say I feel that we've gotten a lot better at it as the weeks have gone by, and yet there's more work to do. So we're trying to keep it top of mind.
With respect to the Lieutenant Governor, and with all due respect to Secretary Pryor, he's been conducting a lot of town halls and webinars and so on and so forth with different silos, particularly on the small business side. What sort of input has he had into this decision to move forward with phase 2 on June 1st?
I mean, I know Stephan's been in touch with him and a lot of those smaller businesses, and any input is good input. You know, he's been elevating to us the concerns of a lot of small businesses. I think he's also done a good job of just helping people with their frustrations. I mean, this is an inherently frustrating time. There's not enough clarity. The rules can be confusing. It's going to cost a little money. So I give the Lieutenant Governor credit for just being with small businesses. Yeah.
Governor, on the diagram for the salons and restaurants, it has allow outside airflow. Is that a request or is that part of the restriction?
One of the areas where the Department of Health under Dr. Alexander Scott has offered guidance to us is that there's a difference between the outdoor environment and the indoor environment in terms of the way this virus spreads, because particles and pathogens will dissipate more rapidly in the outdoors. It is, generally speaking, a safer environment. And the more outdoor air you can allow in, and the more that you can enable a space to be less congested, the better from a safety and health perspective. So that is a feature of our requirements and recommendations for any venue that has indoor activity. So it certainly applies to restaurants, it applies to haircutters, and it applies to gyms and fitness.
Just to be clear, salons and restaurants that may have full air conditioning, they should make it an effort, open windows, get fresh air.
Yeah, there is a difference between fresh air and the recycling of air in the interior space, which is why the diagrams emphasize fresh air and the access to outdoors.
Can they use air conditioners?
That's a question, I think, for Dr. Alexander Scott. I don't know if you want to answer that precise point as to whether they can use an air conditioner. Oh, pardon me.
So air conditioners can be used, but we wanted to really elevate the science that shows that the virus is better controlled when there is fresh air that is conducted from outside. We are continuing to learn about data internationally when there are scenarios where the virus may spread more than with others, and we have seen better outcomes when there's the connection to the fresh air, but we recognize that some places are either only indoors or don't have windows or already have air conditioning, and it's about making sure that businesses have all of the information before them so that they can make decisions that will be best for their individual situation, for their customers and staff.
Scott, do you want to comment on that CDC report that just came out where they're questioning whether or not maybe the virus can survive on a surface, and they seem to indicate it seems more of body-to-body transport of the virus? Any thought on that?
We are continuing to learn more about what that report entails and comparing that with what we're seeing in other places. We know that it is definitely still critical to ensure the environmental cleaning that we are requiring and really emphasizing, but it also highlights the importance of being able to social distance, being able to wear a mask, all of which helps decrease the ability of the virus to be propelled out while someone is just speaking, certainly sneezing or coughing, and land on other people, other clothes, or on other surfaces.
You're a disease and infectious disease specialist. Is this common that a virus that has been so looked at and addressed and they're actually still intrigued at how it passes and transmits, because that's a huge difference if maybe it doesn't go on a surface.
Very much so. It's common. It contributes to the challenges you see sometimes with vaccines being developed for viruses. It's constantly evolving. We are constantly learning and will continue to. That is really why Rhode Island has been able to stay in front, because we've been able to adapt effectively, help bring all Rhode Islanders along, and make sure that the science guides how we inform and direct our policies to occur.
Governor, on the travel restrictions, I believe New York City is the only place I know of that still has a stay-at-home order. Are you specifically looking to limit folks traveling to Rhode Island from the city?
From anywhere that has a stay-at-home order. I don't actually know off the top of my head all the places that have a stay-at-home order. So whoever, the whole concept is that if the governor or mayor in that location feels that they have a problem, there's such high prevalence of the virus, then if they come here, they have to be quarantined. By the way, I expect it'll change. Like maybe New York City is now, perhaps there's an outbreak in, I don't know where, Newark, New Jersey, just to pick on one place, in a month, then it's meant to be a blanket policy.
On gyms, exercise in an enclosed environment with a group of people is, I think, a dangerous area from what I understand. Is there a specific limit on the size of yoga, spin, exercise classes in gyms that will not be allowed?
Yes, so if I could ask you to just hang on until next week and go to reopeningri.com, it's going to be in great detail. And Stephan's also going to have one more town hall with gym owners. We're really trying to come up with all these regulations in concert with them. But the short answer is yes. There's going to be spacing requirements and yeah, well here.
There will be, as the governor was very accurately stating, there'll be parameters for spacing in accordance with RIDO guidance, and there'll be class size parameters as well. I would look forward to the full development of those, but we'll note that the 15-person social gathering size will govern, in many cases, the size of the party or the class. So in this case, a yoga class or a fitness class will likely correspond to that social gathering size, 15 as a maximum, and similarly for a restaurant party. So we utilize the guidance of the Department of Health and translate it through the sector-by-sector guidance documents.
Governor, President Trump has just announced at the White House podium, governors must allow churches to reopen this weekend. And when he was pressed on governors like you, Darnell, later, he said, quote, "I will override the governors." That is obviously, people are going to hear that on the news tonight and think, well, the president says the churches have to reopen, and Governor Raimondo says no. What holds? I realize you probably weren't aware of that because you've been doing the briefing, but
we're going to stick with what we have.
So churches cannot open in Rhode Island this weekend?
Correct.
And you do not see any way the White House would be able to reverse
Not
your-
as I stand here, though you are catching me off guard, so I need to go talk to my general counsel. But after an enormous amount of thought and consideration and hard work on behalf of our faith community, we've landed in a great spot. There's broad agreement from faith-based leaders, and we're not ready. Like, honestly, that would be reckless. It's Friday. They're not ready. So the reason we did it the way we did it is we gave them some time. We announced it, this week so they can get ready for next weekend. They have a lot of work to do. They have to figure out how they're going to do the cleaning, how they're going to serve communion, how they're going to everything. So no, that's not happening in Rhode Island.
You're not aware that your office received any advance word from the White House that
No,
this would be announced
no.
or ordered?
I am certainly not aware, having said that I've been here for 45 minutes, though that wouldn't surprise me that we wouldn't be given a heads up.
On Monday,
He has been clear from the beginning, the president, that governors are on our own in this effort, and it's up to us to decide, when things should open in our communities. It's been a while since I've been in law school, but I don't know of any executive fiat that he would have to overrule a particular governor. So I'll have to go look into that. But we have a good plan right now. It's not a perfect plan. It's not an easy plan, but gosh, we've been in touch with everyone. We've landed on this date. They have a week to prepare. I'm going to stick with it.
On Monday, East Providence is having a parade.
Mm-hmm.
Your thoughts on that? And should other communities that cancel parades, should they revisit that?
Yeah. So the parade, I actually think that's a good example of what to do and how to get creative. As I understand that parade, it's going to be everyone in their car. And if that's really good, like you can acknowledge Memorial Day, which I think is so, so important, and do it in a safe way. So I'm not going to tell other communities what to do, but that's where we're going in this. Yes, you should acknowledge and mark the day of Memorial Day. You should do it in a safe way. And East Providence has figured out a way to do that.
Other communities like Gatsby Days or maybe the Ancient Harbles, if they can come up with something in a car, that would be okay?
Sure.
I know you talked earlier this week about, with the travel restrictions still being placed, people crossing the border to go in and out. Heard some concerns, especially from South County, the Musquamacut area, about especially a lot of people coming from Connecticut into Rhode Island. Do you have a concern about that? Would you consider using the National Guard to patrol more, or can you do anything about that? What do you say to the people down there who are concerned about a lot of out-of-staters now coming in?
So, am I concerned? Of course I'm concerned. It's my job to be concerned about everything. We're on that. We appreciate that, especially on Memorial Day. We're going to kick up our patrols and enforcement with state police, DBR, and in concert with local law enforcement. But I'm not going to do anything too heavy-handed or use the National Guard. We're going to continue to rely on the good judgment of Rhode Islanders. The big difference between now and when I patrolled the border when we started is now people know what's happening. Like the people of Connecticut have been living under the same restrictions as we have for the past couple of months. So I have more confidence and less concern because I think they're going to follow the rules too.
Go ahead.
Go ahead.
Do you have any response from to George Will's op-ed in this morning's Washington Post, where he suggests that you would be the ideal running mate for Joe Biden, and his comment is, an anxious nation longing for competence in the national government might turn its lonely eyes to her if it knew of her.
I haven't seen the piece, but it sounds like he said nice things, so that's a nice thing.
Secretary Pryor or Governor, what does the Block Island Ferry look like in phase 1 and then in phase 2, and how does that impact some of the business decisions going on out there right now?
Yeah, so his answer is we're still figuring it out. It's going to run, I can tell you this, we're going to run the ferry, and are we going to announce it next week?
Yes.
Yes, okay, so it'll be part of phase 2, and we'll have details out next week. So we want to run the ferry, and we're just going to have guidelines around capacity, essentially, and that'll be on reopening RI next week.
Jacob.
Me, Jordan. Some barbershops and salons have expressed concerns about, with reduced capacity and reduced staff. How would that work in terms of how drastically they'd have to reduce staff in order to meet the guidelines on that diagram?
I'm sorry, I couldn't hear you. Could you say it again?
Sure. Barbershops and salons have expressed concern about how much they'd have to reduce staff, especially meeting those requirements that you show on the guidelines there.
We will continue to take feedback from professional haircutters as to what works and doesn't work for them. But what we've heard thus far is that the reductions that is to say, the parameters that we're planning to implement are reasonable and practical. Keep in mind that the kinds of restrictions that we're putting in place apply to things like the waiting room. We ask that there not be one so that customers don't bunch up. We ask that, for example, if there needs to be blow drying, that might be accomplished in a separate room. If there is a separate room, not every salon has one. And maybe that's the room with the access to the outdoors, so there's fresh air. So some of these adaptations don't require reductions in staff at all. Then there are the requirements of keeping the chairs far enough apart that there's social distancing. And then there's requirements for overall square footage and making sure there aren't too many people in one place. What we've gotten thus far in the way of feedback is it will work, especially given that it's phase 2. And under the governor's plan, there's a phase 3. So what we're aiming to do, as the governor said very well earlier, is ensure that more and more businesses can break even, can gear up, and look forward to a phase 3 where they can do even better.
Dr. Alexander Scott, are you concerned with specific issues in close contact businesses that present unique risks for the virus to be transmitted, such as blow drying hair or filing of nails that creates small particles, or something in the course of tattooing that might have a similar effect?
These are all discussions that we have held extensively in moving forward with opening the economy. So all Rhode Islanders can know that a tremendous amount of thought and carefulness has gone into our approach. We've wanted to look at the science, see where it should impact, how we're going forward, and we've really settled around the rationale that you need to be able to continue to wear your mask as you go forward. We know that droplet transmission is the primary way that this virus spreads. Wearing a mask, being able to social distance gives us the best capability to decrease the risk of transmission. With all viruses, all infections, there's always a very small risk, but at a population level here, particularly as we are building the confidence, we can say that we are taking the approaches that by and large significantly decrease the risk of transmission while being thoughtful about safely reopening the economy. And we will provide the guidance that each of these social services or personal services entities will need. The longer the time, the smaller amount of space, the higher the risk, the shorter the time, help them to be creative to help make sure and reassure their customers and staff that this is a safe way to go forward.
Phase 3 by July, as you've said?
Yeah.
You do.
Sure.
Sorry.
So the thing, I should have said it, so thank you. The way we want to do this, and what I've been educated is really the best way to do it, is 14 days of changes, 14 days of observation. So time between phases is about 28 days. So the short answer is yes. June 1st to July 1st, plus or minus a few days. Oh, also the approach for phase 3, the approach for phase 3, the name of the game really is slow and steady. Now, the question you ask, we are still learning about this virus. So you can't go too fast and then learn about something which says, oh, we made a mistake. So in light of all the uncertainty and everything we know and everything we're still learning, we're saying slow and steady, do something, observe. Having said that, phase 2, this has been it's been a lot for us to figure it out, setting by setting, all the questions you were asking. We've had endless phone calls around blow drying, tattooing, waxing, like you can't believe that the details. Because we're trying to get it right, we're trying to give people confidence. Phase 3 is probably not going to be setting by setting excruciating detail. We want to get to a place where we have guidelines, rules that you have to follow, but much more, a set of guidelines that everyone in every setting should follow. So, thank you.
Wait for the weekend. The Trump story is like rocketing. Do you want to just right now clarify? I mean, the president
No
of the
church
States.
this weekend in Rhode Island, the weekend of May 30th.
Where are you going to dinner?
Thanks, everyone.
Okay, so that was a tricky decision. So I called the Hospitality Association and said I wanted Italian, and so they suggested we go to Avio in Cranston, so that's where we're going.
Well, you're not
Okay.
the ballot.
Thank you. Have a good weekend.